Hi, I'm Dr. Rukmini. I'm a senior consultant neurologist at Yashoda Hospital, High-Tech City, and I am working as the director of Parkinson's Disease and Movement Disorder Research Center here. So today I'll be talking a little bit about advanced Parkinson's disease. So Parkinson's disease patients can be treated with multiple medication, and the initial stages of the disease, they respond very well to the medicine. So the whole day they are completely normal. But as the disease progresses, they start developing complications of the medication, such as motor fluctuations and dyskinesias with levodopa. That means that every 2 to 3 hours they would require medication and they'll suddenly become off. It will feel like there is a switch off in their bodies and they cannot move, or they start to have tremors and stiffness and slowness. So their ideas and thought process revolve around the medication. Apart from that, they can have other side effects like dyskinesias, where they have extra movements. Occasionally, if they are on dopamine agonists, they can have disorders like impulse control disorders, where they have large gambling or punding or excessive spending or excessive sleepiness. Sometimes the patients can develop side effects like gastritis, blood pressure drops like postural hypotension, so that when they sit up, stand up, their BP falls and they can't walk around much. They also develop side effects like psychosis or confusion because of the medication. A lot of medications can cause confusion. They develop hallucinations. So at this point, they require advanced therapy. Now, there are multiple advanced therapies, but out of all of them, deep brain stimulation has stood the test of time and is the most effective in all of them. So when we talk about deep brain stimulation, we are talking about placing 2 electrodes which is present within the deep areas of the brain, especially bilateral subthalamic nuclei or bilateral globus pallidus interna. The greatness about the deep brain stimulation is that it stimulates, so it's a reversible procedure. We are not cutting or making a hole or making any lesion in the brain. We are just actually stimulating that part of the brain, and it's completely reversible procedure. And because of the stimulation parameters, as a disease is a dynamic process, dynamic disease, and it keeps on increasing and changing its pattern as the days go by, deep brain stimulation can also be modulated to cater to the patient's needs in the future. Not only that, now we have a lot of technology which has come in, like sensing technology, where we can actually sense what is happening in the brain, and we can modulate the deep brain stimulation based on the sensing. So it is not a continuous process. So when the patient requires the stimulation, they will receive the stimulation, and when the patient doesn't require the stimulation, we can reduce the stimulation. We can modify the other parameters like the pulse width and the rate, the frequency, to make sure that the walking is better, the speech is better, and so forth. The disease itself is very, very small, very minimally invasive. We can do it in awake state or in the asleep state, and the risk because of the DBS surgery is very small. If you talk about all the neurosurgical disorders, the risk based upon the deep brain stimulation is very, very small. So don't be afraid if there's a patient who has got Parkinson's disease, or if you know somebody who has got Parkinson's disease, has got an advanced Parkinson's disease and is not responding very well to medication or is having side effects of the medicine. You have to think about deep brain stimulation. You have to say yes to DBS. Don't be scared. Just come forward, and it will improve your quality of life, and it can improve your social and occupational functioning throughout. Say yes to DBS.
Say yes to DBS.